Hi, I'm Dr. Chung. We'll talk about coronary artery disease and treatments for that and treatment options. Coronary artery disease is the reason people have angina or chest pains and shortness of breath with exertion, sometimes at rest, and eventually in advanced cases can lead to heart attacks. So how do we treat this? What's our general approach? Let's just pretend we're in the office and a patient comes in with symptoms or complaints of chest discomfort and shortness of breath. The typical symptoms include shortness of breath, chest pain. Chest pain is not always just chest pain. It can be a heaviness, it can be a burning sensation, it can be a pressure, it can be a tightness, it can be in the jaw, not necessarily chest, often in the upper back, sometimes in the abdomen as well. So it's very variable. Patients don't always present in the same way. This is particularly true of women. Women tend to present with somewhat unusual symptoms, or symptoms that are different from what's in the textbook. So you always have to be aware. So as a physician, you listen to the story, you get all the things that make it worse, all the things that make it better, then you form an opinion. Then you look at the patient and you look at the risk factors. Do they smoke? Do they have hypertension? Do they have diabetes? Do they have lipid problems? Do they have a family history? If these things are present, then your suspicion that this is due to coronary artery disease goes up. Then you do diagnostic tests that include things like EKG, certain labs, stress test, coronary angiogram, other types, CAT scans, other types of imaging things, imaging studies that supplement your suspicion that are clinical. So your history and physical include all these factors that form your opinion about what the patient is describing. Then you add these diagnostic tests, and then you have a more clear diagnosis. So let's say you have coronary artery disease. How do you treat it? Well, there are different stages. Stage 1 is stable angina, meaning it's a very mild stage of symptoms in the form of symptoms at predictable exercise loads. So a patient might discover that they get chest discomfort and short of breath with 2.5 blocks of walking, but not 1.5. So, and it happens every day. So that's a very predictable, repeatable sequence of symptoms, and that's called stable angina. And then this can proceed to what's called unstable angina, in which sometimes it occurs at rest. You're sitting watching TV and you get this discomfort. It might go away, but it occurs at unpredictable at-rest events, and that's more of a progressive symptom. And then finally, chest pain comes on and it doesn't go away, and that can be a heart attack or a myocardial infarction, okay? So depending on these different stages, your treatments are different because of the different severity and different urgency of this disease condition. So let's take the stable angina patient. So if a patient has stable angina or chest pains due to a partial blockage in the coronary arteries that are reproducible, but you can still go to work, you can go shopping, you can live your life, but you notice it kind of bothers you. Treatment is aimed at several different factors. Medicines. Typically, you want to thin the blood a little bit, and that starts with aspirin, and sometimes additional medicines like Plavix or Brilinta, other types of additional drugs to help thin the blood. You also need to treat the background. So treat hypertension, lipids. So there are medicines to treat hypertension and cholesterol that your doctors might give you depending on how high your blood pressure is, how high your lipids are. Finally, there are medicines that ease the load of the heart, meaning for the same amount of walking or climbing you do, the heart works a certain amount. But there are medicines that can keep it from going too fast or working too hard, and therefore require less oxygen. that can actually help reduce symptoms and help you do more activities with the same blockages. And these are things like beta blockers and calcium channel blockers, typically. There are certain other drugs that treat the symptoms only. So if you get chest pain, you got to treat it. Those are things like nitrates, like nitroglycerin or isosorbide. And there's another medicine called ranolazine, or Ranexa is another name for it, that can actually reduce the chest discomfort that occurs because of coronary artery disease. So these are medical treatments for a stable angina patient. So it usually works. It's an incredibly effective approach to treating patients. Now, let's say the symptoms are improved, but they recur, or they don't respond in some cases. And if the symptoms progress to an unstable state, unstable angina, or a myocardial infarction, then you enter into a different phase. So typically what we start with are angiograms in patients who we know have coronary artery disease and blockages and are having symptoms that are progressive, recurrent, difficult to treat, so really bothersome, unstable picture. What is an angiogram? Well, it's a way to get into the artery of the heart, the coronary arteries, and treat it mechanically. So the heart has arteries that supply blood to it. These are the coronary arteries on the outside of the heart muscle. So if you then extend this out, the aorta goes around to the rest of the body, and it goes all the way down and to the legs, left and right leg, and this is the aorta, which is the main artery of the heart. Traditionally, what we've done is to go puncture this femoral artery in the groin. You thread a wire all the way up into here, and then not a wire, a little catheter, a little tube that goes into here. Then you inject the dye right into the coronary artery itself, and a camera goes around and takes picture of that dye. And so you can actually see which arteries have blockages, because this would be covered in with the dye, and where there's a defect, you can see that there's a blockage there. Once you've done the angiogram, if you determine that there's a blockage in this segment that needs to be opened up because it's so tight, then comes the angioplasty and stent treatment, okay? If you have an artery that has, let's say, a 95% blockage, and it's determined that you should open it up because that's causing symptoms, now comes angioplasty and stent treatments. These are relatively simplified words, but essentially that's what we're talking about. Through the same hole in the groin, you push a wire, a thin wire through here, and over that wire, you put in a balloon which goes in flat, but then you can blow it up so that it becomes a big balloon, and it squeezes this blockage up against the wall. It just smushes it, maybe spreads it out a little bit, but opens it up. Then in order to keep it open, you take the balloon out and you thread a stent, which is essentially a metal tube of multiple different types of material, and then a balloon that's inside of that opens it up, and now you have a stent that's mechanically holding up the artery. And this is very, very effective for reducing symptoms. It's also very, very effective at keeping the artery open. Now, these treatments have not really shown to improve your length of life per se, but it depends on where you put it, depends on where the blockages are. So these stents are used all the time now. A lot of these stents have what we call drug coating. So the inside of the stent has various different kinds of drugs coated onto it to keep the blood from clotting and to keep the stent from clogging up over time. So, and then everything comes back out, and in the groin, you would hold pressure to keep the bleeding from recurring. So you got to have that little hole seal up, And then after about 4 hours, you can sit up and probably walk around and usually go home the next day. So this is a very effective treatment for unstable angina patients and actually those who present with heart attacks. But it's very important that these patients still receive the appropriate drug therapies, including beta blockers, lipids, and platelets, or blood thinners and things like that. So these types of treatments that I mentioned for stable patients also apply to unstable patients who've had stents done. So it's very important to keep that in mind. Thank you very much.